Welcome back to CLE Weekend. This morning, we are joined by Dr. Blanda, Medical Director for Buckeye Health Plan, to talk about ways to prevent and manage chronic illnesses. So first of all, thanks for coming on.
Oh, thanks for having me.
Oh, absolutely. So we hear the phrase chronic illness, right? A lot of us do, from different medical professionals. And you're like, okay, what exactly is a chronic disease or an illness like this?
So the term chronic conditions refers to a medical issue that is long-lasting, that's going to last over a year, and it's going to require medical care. And for many people, it's going to affect their daily life. And the Center for Disease Control believes that it is the leading cause of death in the United States, and nearly half the people in the United States are affected by a chronic condition.
Wow. How many people here in Ohio are impacted by chronic conditions?
Ohio has a high prevalence of chronic health problems. And so we're talking about things like that you've heard of: diabetes, hypertension, heart disease, stroke, cancer, the respiratory illnesses like asthma and COPD, and arthritis. Those are the kind of things that need chronic management. And you know, the Ohio Medical Association reports that 40% of people have diabetes, hypertension, and heart disease, and 20% of people are living with two or more. And these chronic conditions, such as cancer, cardiovascular, and diabetes, are the leading cause of death in Ohio.
Death, wow. Now, some of these things, I mean, how did they develop, right, these chronic conditions?
Well, they develop.
I'm sure it's a number of factors, but.
Well, they develop over time. And so that's that kind of thing that, you know, when you're healthy, you want to be monitoring a little bit. And so they will develop over time, and we have screening for them. And you may be genetically predisposed to that. You may have other medical problems that lead you to that. And you may have some environmental things. But when you look at like diseases like hypertension and heart disease, those are caused mostly by our lifestyle. So we're talking about things like your diet, your lack of physical activity, excessive alcohol, and sometimes the use of, you know, tobacco and things like that.
Well, I can imagine cutting back on those things would help. Any tips, though, for people with, you know, a chronic condition to kind of help manage it?
So for people with chronic conditions, the most important thing is to kind of visit your doctor and develop a plan of care that you're going to manage it. You're going to have a plan that you're going to follow. And the other thing that you can do is do some lifestyle modifications. So you can do things like, I'm going to eat nutritious. I'm not going to drink soda and pop. I'm going to have half of my plate be green. I'm going to commit to doing some physical activity. I'm not going to use any tobacco, any products of tobacco. And I'm going to limit my alcohol consumption. The other thing is there are other things like for stress reduction. I'm going to be mindful. I'm going to go out in nature. I'm going to get enough sleep. Those kind of things will reduce stress.
Okay, now let me ask, if this stuff is not, you know, managed well, or, you know, people go undiagnosed, I mean, it can be a very serious problem. Like, you've got to get in to see your doctor.
Right. So remember that, you know, when you look at the outcomes from some of these chronic diseases, they're not good things. They're things like stroke, heart attacks, kidney failure that leads to dialysis. These are things that are going to affect your life forever, so you do want to manage them.
Now, how is Buckeye Health Plan, of course, helping Ohioans prevent and even manage these chronic conditions?
Buckeye is committed to giving good health to the people in Ohio. And so we do that in different ways. So the one thing we encourage is that people go to their doctor. They go to the annual visit and they do the preventative screenings. And we do offer an incentive bonus to people, like an incentive pay. It's called My Health Pays. So you get $75 if you go to your appointment, and you may get additional monies if you do additional screenings. And those monies can be used for paying bills and your utilities and rent. The other thing that we do is we offer transportation to and from the doctor. So if you schedule that before 48 hours, you can get a ride if you need that. And then, of course, we pay for the medications. And for people who can't navigate or have difficulty navigating the healthcare system, we do offer care guides who may help you with episodic care. And if you have very complex cases, we'll offer you case management, where you have a one-on-one person that you call to help you out.
Yeah, it makes it very helpful. Helpful, especially to the people who need it. It's very important. All right, let us know, where can we get more information if we do want to come and see you guys and you know, make an appointment and set that up?
More information can be found at buckeyehealthplan.com.
Wonderful, Dr. Blanda. Thank you so much. I appreciate it.
It was my pleasure.
We'll be right back on CLE Weekend.